I killed someone 3 years ago. Not directly. The patient was already dying. But I made a mistake that probably hastened it by a few hours. And then I lied about it. I'm Jennifer Moss, ICU nurse for 9 years. And I've been covering up my medication errors for the past 3 years by falsifying records and blaming equipment malfunctions. I've destroyed evidence. I've thrown a colleague under the bus. And I do it because the alternative, admitting what I've done, means losing everything. The first mistake was genuinely an accident. Mr. Patterson, 76, septic shock, multiple organ failure. He was on a complex medication regimen, pressors, sedation, antibiotics, the whole arsenal. I was supposed to hang vancomycin at 500 milligrams. I hung 5,000 milligrams. Simple decimal error, 1 misplaced 0. The kind of mistake that's supposed to be caught by multiple checkpoints. Scanning, double-checking, pharmacy verification. But I was slammed that night, 4 high-acuity patients, another nurse had called out, and I was moving fast. Too fast. I realized the error an hour later when I went to document. My stomach dropped. I checked the patient, vital stable for now, but that much vancomycin could cause kidney damage, could push his already failing organs over the edge. I should have reported it immediately. That's the protocol. That's what we're trained to do. Medication errors happen. They're part of being human. The system is supposed to catch them and minimize harm. But I froze because Mr. Patterson was already actively dying. His family had decided on comfort care, had signed the DNR that morning. He probably had hours, maybe a day. And if I reported this error, there would be an investigation, documentation, possibly a report to the Board of Nursing. A mark on my record that could follow me forever. So I did nothing. I watched him closely for the rest of my shift. His kidneys were already failing, so when his renal function worsened, no one questioned it. He died 6 hours later. At the end of my shift, I went into the medication system and altered my documentation, changed the 5,000 back to 500. It was shockingly easy. A few clicks, a note about correcting documentation error, and the evidence was gone. I told myself it didn't matter. He was dying anyway. The error probably didn't change anything, and reporting it wouldn't bring him back. It would just destroy my career for no reason? I managed to almost believe that for about 3 months. Then I made another mistake. Wrong rate on a heparin drip. Caught it within 30 minutes, no harm done, but instead of reporting it, I just corrected it quietly, adjusted the pump, backdated my documentation, pretended it had been right all along. Because if I reported that one, they might start looking at my recent cases, might find inconsistencies, might discover Mr. Patterson. After that, it was like I couldn't stop making errors. The stress of covering up made me sloppy, distracted. I'd be double-checking documentation instead of double-checking medications. I'd be so anxious about getting caught that I'd make exactly the kinds of mistakes I was trying to hide. Year 2, I was averaging 1 significant error every 6 weeks. Wrong medication, wrong dose, wrong rate, wrong time. Most didn't cause harm, I'd catch them quickly, or the patient was stable enough that it didn't matter. But each one required a cover-up. Each one meant more falsified records, more altered timestamps, more lies. I started blaming equipment. The pump malfunctioned. The barcode scanner wasn't working. The previous shift must have documented wrong. I became an expert at creating plausible explanations for discrepancies that couldn't be traced back to me. Other nurses started noticing problems. That's weird. This doesn't match what I documented. I could swear I hung this at a different rate. But no one suspected me specifically. I was a senior nurse, experienced, reliable. If there was a problem, it must be the system. Then came Sophie. New grad, 6 months on the unit, eager to please, terrified of making mistakes. We were both assigned to the same pod one night, and I made an error with one of my patients. Wrong potassium dose, gave 40 MEQ IV push instead of PO. Realized it immediately when the patient's rhythm went abnormal. I should have called a code, should have reported it. Instead, I stabilized the patient, gave calcium, corrected the rhythm, got him through it. And then I documented that Sophie had given the medication. I backdated a note saying that I'd asked her to give it while I was busy with another patient. Made it look like she'd misread the order, had given IV instead of PO, created a whole narrative in the chart that pointed to her error, not mine. They investigated, pulled her into a meeting with the manager and the unit director. She cried, said she didn't remember giving that medication, that she always double-checked. But the documentation showed her name. The system showed her badge scan. She couldn't explain it. Neither could they. She got written up, mandated to work under direct supervision for a month. She was devastated. I watched her cry in the break room and felt nothing except relief that I was safe. She quit 3 months later, said she couldn't handle the stress, couldn't trust herself anymore after that mistake. Last I heard, she'd left nursing entirely. Went back to school for something else. I destroyed her career to save mine. And I've had to live with that for 18 months.
The errors kept happening. I'm up to maybe 2 or 3 a month now. The stress is making me worse at my job, which creates more stress, which creates more errors. It's a cycle I can't break. I've started having panic attacks before shifts, lying awake at night running through every medication I gave, every documentation entry, wondering if I missed something, if someone will notice an inconsistency. I've lost 12 pounds. I'm on anxiety medication. Ironic, considering. My husband thinks I'm just burned out from the pandemic. He keeps suggesting I take some time off, find a less stressful unit. I can't leave. If I transfer or quit, they might audit my cases as part of the exit process, might find the patterns, might realize what I've been doing. I'm trapped in this unit, in this cycle of error and cover-up, and I don't know how to get out. Last month, I made a mistake that actually harmed someone. Mrs. Chen, 64, post-surgical, stable. I gave her metoprolol 50 milligrams instead of 5 milligrams. Her pressure dropped dangerously. Heart rate dropped to the 30s. We had to give atropine, fluids, close monitoring. She was okay, ultimately, but it was close. I blamed a pharmacy error, said the medication must have been labeled wrong. They investigated the pharmacy, audited their processes, found nothing wrong. Eventually concluded it must have been a one-time labeling error that couldn't be replicated. The pharmacist got written up for inadequate checking procedures. I know him. Jason, nice guy, meticulous, takes pride in his work. He was baffled, insisted he hadn't made a mistake. No one believed him. I let another person take the fall from my error. Again. I'm writing this at 3 a.m. Can't sleep. I work in 5 hours, and I'm already anxious about what mistakes I'll make, what I'll have to cover up. There's an investigation starting next week. Multiple medication discrepancies on the unit over the past 6 months. They're bringing in an external auditor to review documentation, interview staff, analyze patterns. I'm terrified they'll find the alterations, the pattern of equipment malfunctions always happening on my shifts, the timestamps that don't quite match up. My manager pulled me aside yesterday. Jennifer, you've been on this unit a long time. Have you noticed anything unusual with medication administration? Any patterns? I told her no, looked her in the eye, and lied. Because what else can I do? Confess? Yes, actually, I've been making errors and covering them up for 3 years. I falsified documentation in a death case. I destroyed a new nurse's career to protect myself, and I've been blaming innocent colleagues for my mistakes. I'd lose my license, face possible criminal charges, falsifying medical records, patient endangerment. Might even face civil suits from patients or families if they realized harm had occurred because of my errors. Everything I've worked for, gone. 12 years of school and training, 9 years of experience, my entire career, my identity, my income. And for what? To admit to mistakes that mostly didn't cause lasting harm? That were accidents, not malicious?
That's what I tell myself in my worst moments, that the mistakes were human errors, that the system should have caught them, that I'm just protecting myself from a system that's too punitive, too quick to destroy careers over honest mistakes. But I know the truth. The first mistake was an accident. Everything after that was a choice. Every falsified record, every blamed colleague, every covered-up error, those were choices I made to protect myself at the expense of everyone else. Sophie didn't deserve what I did to her. Jason didn't deserve to be written up. My patients didn't deserve to have a nurse so stressed and anxious from covering up mistakes that she kept making more of them. I'm sitting here with my laptop open, the unit's incident reporting portal up on the screen. All I have to do is type it all out. Confess everything. Accept the consequences. My finger is hovering over the keyboard, but I can't make myself type because once I hit submit, it's over. Everything is over. My phone just buzzed. Text from my manager. Can you come in early today? We're short and need someone reliable. Reliable. That's what they think I am. I'm getting in the shower, getting ready for my shift. Gonna go in and be the experienced, dependable nurse everyone thinks I am. And I'm gonna hope, desperately, pathetically hope, that today isn't the day I make the mistake I can't cover up. The one that finally exposes everything. The one that actually kills someone in a way I can't rationalize or hide. Because I know it's coming. The law of averages says eventually I'll make an error that causes undeniable, serious harm. And when that happens, when they investigate, they'll find all of it. Every lie, every cover-up, every person I sacrificed to save myself. And I'll deserve everything that comes after. But today isn't that day yet. So I'm going to work. I'm going to smile. I'm going to take care of patients, while carrying the knowledge that I'm a danger to every single one of them. Because I don't know how to do anything else anymore.
I control who works when on my unit. Not officially. I'm not the scheduler, not management, just a staff nurse. But for the past 4 years, I've been manipulating the schedule so completely that I almost always work with exactly who I want, when I want. And I've destroyed careers to do it. I'm an ICU nurse, 11 years on the same unit, and what started as avoiding a coworker I didn't mesh with has become a full-time obsession. I spend more hours plotting schedule changes and manufacturing workplace drama than I spend actually thinking about my job or my family. It started small. Year 7 on the unit, we hired a nurse who just grated on me. Nothing specific, just personality clash. She was loud, overly cheerful, asked too many questions. Working 12-hour shifts with her felt interminable. So I started trading shifts. If I saw I was scheduled with her, I'd find someone to swap with. Easy enough. People trade shifts all the time. But then she started picking up extra shifts on my schedule, and there were only so many people willing to trade. So I got creative. I started building relationships strategically, figured out who needed what, who needed certain days off for their kids' activities, who wanted weekends, who preferred nights. Then I'd offer trades that benefited them, build up goodwill. So when I needed to avoid someone, I had a network of people who owed me favors. Within 6 months, I was working almost exclusively with my preferred group, the people who were efficient, quiet, professional, who didn't annoy me. It felt good, like I'd figured out how to game the system, make my work life better. I was proud of it, honestly. Then that nurse, the loud one, started complaining that people didn't want to work with her. She wasn't wrong. I'd been quietly poisoning the well, mentioning to people in casual conversation that she'd messed up certain things, that she was hard to work with, that I'd avoid picking up shifts with her if possible. Nothing too obvious, just strategic comments that made people think twice about trading into her shifts. She transferred to another unit after 10 months, said she never felt like she fit in, that people seemed to avoid her. My manager asked if I knew why. We'd been hired around the same time. Maybe I had insight. I said I had no idea. that maybe ICU just wasn't her personality type. I felt good about that too. Problem solved, and I'd never have to work with her again. Year 8, I started expanding my control. It wasn't just about avoiding one person anymore. I had preferences about the whole team composition. I worked best with certain nurses, certain techs. Shifts ran smoothly when we had the right mix of people. So I started orchestrating that. I'd look at the monthly schedule the moment it posted, identify the shifts that had good team composition, and make sure I was on those. Trade away from the shifts with problematic combinations. Encourage other good nurses to trade onto my shifts. The scheduler started noticing, "You trade shifts more than anyone on the unit. What's going on?" I told her I just like to accommodate people's needs, that I was flexible. She seemed satisfied with that answer. Really, I was building a system. I had a spreadsheet at home, still have it actually, tracking everyone's patterns, who they liked working with, who they avoided, what days they preferred. I used that information to facilitate trades that benefited me. If I needed someone to trade onto a specific shift, I'd figure out what they wanted and make it happen. Suddenly, everyone thought I was so helpful, so accommodating. What they didn't realize was that every trade I facilitated was ultimately about controlling my own schedule. Year 9, things got darker. There was a nurse, been on the unit for 3 years, competent, well-liked, who refused to trade with me anymore. Said she'd noticed I only asked when it benefited me, never when I was actually helping her out. She was right, and she started telling other people to be careful about trading with me, that I was manipulating the schedule. I couldn't have that. If people stopped trading with me, my whole system collapsed. So I started a rumor. Nothing dramatic, just a strategic mention to a few people that I'd noticed her charting was sometimes incomplete, that I'd had to fix things after her shifts, that I was concerned about her attention to detail. It spread. Within a month, people were questioning her competence. She started getting excluded from the group, getting the difficult assignments, getting questioned by management about her documentation. She filed a complaint about workplace bullying. HR investigated, found nothing concrete, just a vague sense that people didn't respect her work anymore. They mandated some team-building exercises. She quit 6 months later, transferred to another hospital, told people on her way out that someone had systematically destroyed her reputation, and she couldn't prove who. I was at her goodbye party, smiled and said I'd miss working with her. Felt nothing except relief. My husband started commenting around then that I was different. You're always on your phone, always texting with work people. Even on your days off, you're obsessing about the schedule. He was right. I'd check the schedule multiple times a day. The moment trades were posted, I'd analyze them, figure out how they affected me, start planning counter trades. I had alerts set for schedule changes. I'd wake up at 2 a.m. to check if new shifts were posted. I'd spend hours texting with people, building relationships, setting up trades weeks in advance. "It's just work stuff," I'd tell him. "Just coordinating schedules." Really, I was plotting. Constantly. Who needed to be moved? Who needed to be influenced? What drama could I create or resolve to maintain my control?
Year 10. Another nurse became a problem. She was trying to do the same thing I was doing. Control her schedule through strategic trading. We were competing for the same shifts, the same trade partners. I couldn't let that happen. This was my system. So I manufactured a conflict between her and one of the other popular nurses. Told each of them that the other had been talking behind their back. Showed text messages, real ones, but taken out of context to seem malicious. They had a huge fight in the break room. Both got written up. The relationship never recovered. The nurse I'd targeted stopped trading shifts after that. Said she couldn't deal with the unit drama anymore. Just took whatever schedule she got assigned and kept her head down. Victory for me. One less competitor. But it required maintenance. I'd created this rift, and now I had to manage it. Make sure those two nurses stayed hostile to each other, because if they ever compared notes, they might realize I'd orchestrated the whole thing. More time spent managing drama, more texts, more conversations, more strategic mentions to keep the conflict alive. My daughter asked me once why I was always texting. "Are you talking to Grandma?" "Just work friends, honey," I said, while I was actually texting someone about how to get out of a shift next week without it looking suspicious. I'd missed her piano recital that day. Told her I had to work. Really, I'd traded onto a shift because working that day meant I could trade out of a worse shift the following week. She'd stopped inviting me to things after a while. My son, too. They assumed I was always working. Really, I was just always thinking about work, about schedules, about control. Year 11, the unit culture had become toxic. Everyone noticed it. High turnover, people calling out constantly, cliques and conflicts everywhere. Management brought in consultants to assess workplace dynamics. They interviewed everyone, tried to figure out why morale had tanked. I played the concerned veteran nurse. I think people are just stressed. Healthcare is hard right now. Maybe we need team building. I didn't mention that I'd orchestrated at least half of the conflicts on the unit, that I'd destroyed relationships, started rumors, created drama, all to maintain control over who I worked with. 3 more nurses left that year. 1 transferred, 2 quit healthcare entirely. Exit interviews mentioned toxic culture and workplace bullying, but no one could identify a source because I was subtle. I never did anything obvious, just strategic comments, manufactured misunderstandings, carefully placed rumors. The scheduler retired last month. The new scheduler is less accommodating. She's noticed the excessive trading, the patterns, the way certain nurses always seem to work together while others are isolated. She called me in. I've been analyzing trade patterns. You're involved in over 60% of all trade patterns on this unit. That seems excessive. I explained that I was just trying to be helpful, that I liked accommodating people's needs. It looks more like you're controlling the schedule, she said. That ends now. I'm limiting each nurse to 4 trades per month, and I'm going to be watching for trade patterns that suggest manipulation. 4 trades a month? That's nothing. That completely destroys my system. I've been having panic attacks since that meeting. How am I supposed to control who I work with? How am I supposed to avoid the people who annoy me, ensure good team dynamics, maintain my work quality of life? My husband said something last night that hit me wrong. Maybe this is good. Maybe you can finally stop obsessing about the schedule and just work like a normal person. But I can't be a normal person. I've built this entire system over 4 years. I've invested hundreds of hours into managing relationships, orchestrating trades, maintaining my control. And now it's falling apart. Worse, I'm starting to notice that people are avoiding me. The nurses I thought were my friends, the ones I traded with constantly, they're distant now. Like they realized I was using them. Last week, I asked someone to trade shifts with me, one of my usual trade partners, and she said no. Just flat out no. No excuse, no explanation. I asked why. She looked at me for a long moment and said, "Because I finally realized that you only talk to me when you need something. You're not my friend. You're just someone who uses people." That stung. Because it was true. I don't have work friends. I have strategic relationships. People I've cultivated and manipulated for years to serve my own purposes. And my family? My husband is distant. Says I'm never really present even when I'm home. My kids are teenagers now, and they've learned to not rely on me. I've missed too many events, rescheduled too many plans because I was managing work drama or setting up trades. I'm sitting here at 11 p.m. on a Friday night with my spreadsheet open, tracking everyone's schedules, analyzing the new trade restrictions, trying to figure out how to maintain some level of control. My daughter walked past my office, saw the spreadsheet. "Are you seriously still working on that schedule thing? It's important." More important than Dad's birthday dinner tonight? I'd forgotten. Completely forgotten. I was supposed to be at a restaurant an hour ago. She just shook her head and walked away. I closed the spreadsheet sat in the silence, tried to remember when all this became more important than my actual life. Year 7, I think, when I first decided that avoiding one annoying coworker was worth the effort of manipulating the schedule. And now, 4 years later, I've destroyed multiple careers, created a toxic work environment, alienated my family, and lost myself in a system of control and manipulation that doesn't even work anymore. The new scheduler's restrictions start next week. 4 trades maximum. No more control, no more system. I should feel relieved. This is an opportunity to stop, to let go, to just accept whatever schedule I'm given and focus on my actual job. But I can't be a normal person. Without the schedule manipulation, without the control, without the constant plotting and strategizing, who am I? Just another nurse on a toxic unit that I helped create. A wife who forgot her husband's birthday. A mother whose kids have learned to not count on her. And a person who spent 4 years destroying other people's careers because I couldn't handle working with someone who was just slightly annoying.
I'm opening my laptop, looking at the spreadsheet one more time. I should delete it, let it go, accept that it's over. But I can't make myself do it. Because this system, this control, it's all I have left.
I have an entire room in my house filled with stolen hospital supplies, IV start kits, syringes by the thousands, boxes of gloves, sterile dressing supplies, medications, the non-controlled ones, tubing, catheters, wound care products, even small equipment like pulse oximeters and blood pressure cuffs. Current street value, probably $30,000, maybe more. I'm an ICU nurse, 12 years in, and I've been stealing from my hospital for 5 years. It started during COVID when we thought the world was ending and supplies were genuinely scarce. Now it's just compulsion. I take something every single shift, and I can't stop, even though I know it's theft, even though I've never used 99% of what I've taken, even though it's destroying my life. March 2020, everything changed. PPE shortages, supply chain disruptions, news stories about nurses wearing trash bags because they had no gowns. We were rationing N95s, reusing them for days. The hospital felt like it was barely holding together. I was terrified, not just of getting sick, of not being able to help people because we'd run out of supplies, of showing up to work and having nothing to work with. So I started taking things home, just in case, I told myself. A box of gloves here, some extra masks there, a few IV start kits, stuff we had enough of, stuff that wouldn't be missed. I justified it completely. If things really fall apart, I'll need these to help people, to keep my family safe. This is emergency preparedness. My husband saw the growing stash in our garage. Isn't this hospital property? They don't care, I said. Everyone's doing it. And if society collapses, we'll be glad we have this stuff. He looked uncomfortable, but didn't push it. The pandemic eased. Supplies stabilized. I should have stopped. Should have been relieved that the crisis was over. Instead, I kept taking things. Because by then, it wasn't about emergency preparedness anymore. It was about the feeling I got when I brought supplies home. This sense of security, control. Like I was protecting myself against an uncertain future. Year 2, I had an entire closet filled. Boxes stacked floor to ceiling, organized by category. Respiratory supplies, IV supplies, wound care, medications, PPE. I'd go in there sometimes, just to look at it, to count things, to reorganize. It felt calming. Like as long as I had all of this, I'd be okay. Whatever happened, I'd be prepared. My husband asked when I was planning to stop. The pandemic's over. You don't need all this. You never know. There could be another pandemic. natural disaster, supply chain disruptions. This is just smart planning. But it wasn't planning. It was hoarding. I started taking more. Not just the little stuff, bigger items. Portable monitors that weren't being used. A spare blood pressure machine from storage. A box of unused stethoscopes. Equipment that was technically inventoried but wouldn't be missed immediately. The closet became 2 rooms. We have a 3-bedroom house, 1 bedroom for us, 1 for each kid, and a home office. I convinced my husband we should turn the office into storage since he could work from the dining room table. Really, I needed more space for the supplies. Year 3, the hospital started noticing discrepancies. Supply counts weren't matching up. Things were going missing. Not huge amounts, but consistent small losses adding up over time. They audited the unit, reviewed badge access to supply rooms, interviewed staff. I was terrified, but I was also careful. I never took things during the same shift I worked. I'd badge into supply rooms on my breaks when other people were around, so it looked like I was just getting what I needed. I'd take small amounts, a few items at a time, nothing obvious. They narrowed it down to a few possibilities, but couldn't prove anything. Eventually, they installed cameras in the main supply rooms and increased security. I should have stopped then. Should have realized I was risking my entire career. Instead, I got more creative, started taking supplies from patient rooms at the end of shifts, unopened items that would have been wasted anyway, took things from the code cart when it was being restocked, grabbed extras when doing inventory counts. The room became 2 rooms. We converted my son's bedroom, he'd gone to college, into additional storage. My husband was upset, but I convinced him it was temporary, that I'd donate everything eventually. To who? He asked. Who needs thousands of IV catheters? I didn't have an answer, because the truth was, I wasn't planning to donate anything. The thought of giving it away made me anxious, like I was losing security. Year 4, I got written up. Supply discrepancy in my unit, and I was one of 3 nurses who had had access during that time frame in question. My manager called me in. Do you know anything about missing supplies? A whole box of central line kits is unaccounted for. I knew. I'd taken them. They were in the 2nd storage room, still in the original box, unopened. Would never use them, didn't even know how to place a central line. That was a physician's skill. But I'd seen them and thought, what if? And taken them. No idea, I told her. Maybe they were used and not documented properly. She looked skeptical, but had no proof. If you see anything unusual, let me know. We take inventory discrepancies seriously. I nodded, felt guilty for about 3 hours. Then I took a box of surgical masks on my way out that day because I couldn't help myself. My kids started noticing. My daughter came home from college for break, asked why her old room was filled with medical supplies. Mom, this is insane. You have enough stuff here to run a small clinic. Are you planning to open a medical practice or something? It's just, I like being prepared, I said weakly. She looked at me like I was a stranger. This isn't prepared. This is hoarding. Have you talked to someone about this? I told her I was fine, that she didn't understand the healthcare environment, the constant supply shortage concerns. But she was right. It was hoarding. I'd crossed the line from preparedness to compulsion years ago. I started having intrusive thoughts about supplies. During patient care, I'd see unused items and immediately think about taking them. In meetings, I'd be planning how to access certain supply rooms. On my days off, I'd think about what I could get on my next shift. It became like an addiction, the high of successfully taking something without getting caught, the relief of adding it to my collection, the anxiety if a shift went by without me taking anything.
Year 5. This year, they did another audit. More sophisticated this time. Tracked not just badge access, but also what was ordered versus what was used. Cross-referenced staffing schedules with supply discrepancies. They narrowed it down to me and one other nurse. called us both in separately. Your shifts consistently correlate with supply losses, my manager said. Small amounts, various items, but the pattern is clear. Do you want to explain that? My mouth went dry. This was it. I was going to be fired, possibly arrested, definitely losing my license. I don't know what to tell you, I said. I don't take supplies. Maybe it's coincidence. She stared at me for a long time. If someone comes forward now, admits to taking supplies and returns them, we might be able to handle this administratively rather than involving police. But if we find definitive proof of theft, that's a criminal matter. I said nothing, just sat there, terrified, trying to keep my face neutral. She let me go with a warning. We're watching. If you know anything, now's the time. I went home that day and looked at my 2 rooms of stolen supplies. Probably $30,000 worth of hospital property. Evidence of hundreds of thefts over 5 years. I should return it. Anonymously, somehow. Just make it all disappear so I don't get caught. But I can't. The thought of giving it up makes me physically anxious. What if I need it? What if there's an emergency? What if supplies become scarce again? My husband found me in the storage room at 2 a.m. last week, reorganizing boxes, counting inventory. This has to stop, he said. You're obsessed. You're risking everything for what? Boxes of gloves you'll never use? You don't understand, I said. Having these supplies means I'm prepared. I'm safe. You're not safe, he said. You're committing a crime every shift. And you can't stop yourself. That's not safety, that's compulsion. He's right. I know he's right. But I can't stop. Yesterday, I took a box of IV pumps. 4 brand new pumps worth probably $2,000 each. Just wheeled them out on a cart, put them in my car, drove home. I don't even have a youth for IV pumps. Don't have the medications or the training to use them outside a hospital. They're sitting in my garage right now, still in the boxes. I took them because they were there. Because I could. Because the compulsion to take is stronger than my rational mind. My manager called me this morning. We need to talk. Can you come in before your shift? This is it. They have proof. They're going to fire me, possibly press charges. I should be scared. Should be planning my defense, thinking about lawyers. Instead, I'm in the garage, looking at the IV pumps, thinking about whether I should hide them better, thinking about what else I can take before they catch me. My daughter called earlier. She talked to her brother about the storage rooms. They want to stage an intervention. Think I need professional help. Mom, this is hoarding disorder. It's a real psychological condition. You need therapy, and you need to return everything before you get arrested. I told her I'd think about it. Hung up. Immediately started cataloging what I have, making sure nothing's been disturbed. Because these supplies, this collection, they've become more important to me than my job, my reputation, my family. And that's insane. I know it's insane. But I still took a box of Rune dressings on my way out of work last night, hid it under my coat, felt that rush of relief when I made it to my car without being stopped. Meeting with my manager was in 2 hours. This might be the last day I work as a nurse. Might be facing criminal charges by the end of the day. And I'm sitting in my garage, surrounded by $30,000 of stolen supplies I'll never use, trying to decide what to take with me to the meeting. Not because I need it, just because the thought of leaving the hospital without taking something makes me more anxious than the thought of getting arrested. I don't know when preparedness became compulsion. Don't know when just in case became can't stop. I just know that I have 2 rooms filled with evidence of my crime, a family that's scared for me, a career that's about to end, and I still can't imagine giving any of it up. My husband's calling.
Probably to ask if I've returned anything, if I've gotten help, if I've stopped. I'm not answering, because the answer to all of those questions is no. And right now, that feels like the scariest thing of all.
I know his schedule better than I know my own children's. I know he gets to the hospital at 6:47 a.m. on weekdays, that he takes his coffee black with 1 sugar, that he does evening rounds between 6 and 7 p.m., that he leaves through the south entrance, that his car is a silver sedan parked in slot B47. I know his wife's name, where she works, what their house looks like, that they have 2 kids in elementary school. I know all of this because for the past 5 years, I've been obsessed with a married attending physician, and it's destroying everything. I'm an ICU nurse, 13 years in, and what started as professional admiration has become a full-blown fixation that's consumed my life. I trade shifts to work when he's on service. I've learned his routines. I manufacture reasons to be near him. And recently, I started following him outside of work. I know how this sounds. I know it's not normal. But you don't understand. There's something between us, a connection. He just doesn't see it yet because of his situation, because he's married, because I haven't found the right way to show him. It started innocently. Year 8 on the unit, new attending physician joined our intensivist team. Brilliant, kind, excellent with patients and staff. Everyone respected him. I admired his clinical judgment, his teaching style, the way he handled difficult family conversations. Professional respect, that's all it was at first. Then one day, we were both in a patient's room during a code. He was managing the code, I was pushing meds, and we had this moment of perfect synchronization. He'd call for something, I'd already have it ready. Our rhythm was flawless. Afterward, he said, "Great work in there. You're really good at this." It was just normal praise, the kind attendings give to nurses all the time. But the way he said it, the way he looked at me, I felt seen, valued, special. I started paying attention to him after that, noticing when he arrived, what cases he was working on, how he interacted with people. Telling myself it was just professional interest, wanting to learn from the best. But it was more than that. I started feeling excited on days I knew he'd be on service, disappointed on days he wasn't. I'd volunteer for the sickest patients, because those were the ones he'd be most involved with. Year 9, I started trading shifts specifically to match his schedule. He worked Monday through Friday usually, occasional weekends. I'd rearrange my schedule to maximize the days we overlapped. My husband noticed. "You're working a lot of weekdays now. I thought you preferred weekends." I told him the pay was better for weekday shifts. He believed me. Really, I was arranging my entire work schedule around a doctor who barely knew I existed. I started bringing him coffee. I was getting some anyway, I'd say, handing him a cup. Black with 1 sugar. I'd learned his preference by listening to him order in the cafeteria. He'd thank me, smile, go back to his charting. I'd replay that smile for hours. I started staying late on my shifts, timing it so I'd be there during his evening rounds. Just finishing up documentation, I'd say, if anyone asked. Really, I was hoping for interaction. A question about a patient. Another moment of that perfect synchronization. My coworkers started teasing me. "Someone has a crush on the attending." I laughed it off. Don't be ridiculous. He's married. But they were right. And it was becoming less of a crush and more of an obsession. Year 10, I started researching him. Found his social media. He was private on most platforms, but his wife wasn't. I scrolled through years of her posts. Their wedding photos, their kids' birthdays, their family vacations. I told myself I was just curious, just learning about someone I worked with professionally. But I was studying them, analyzing their relationship, looking for cracks, evidence that they weren't happy, that there was room for someone else. I found his address through a professional directory. Drove past their house one evening, just to see it, just to understand his life better. It was a nice house. Toys in the yard, basketball hoop in the driveway, the kind of house that screams happy family. I drove past 3 more times that week.
Then I started going regularly, once a week at first, then twice. I'd tell my husband I was running errands, drive across town, park down the street from their house, and just sit there, watching. I saw him arrive home, saw his wife greet him at the door, saw him playing with his kids in the yard. I should have felt guilty, should have recognized this as stalking, as violation of boundaries, as deeply wrong. Instead, I felt closer to him, like I understood him better, like we had a deeper connection. Year 11, things escalated at work. I started engineering situations to be alone with him. If I saw him heading to the break room, I'd follow. If he was reviewing charts, I'd find a reason to chart nearby. I learned his preferences for everything, what kind of pens he used, what time he took lunch, which desk he preferred. I'd make sure his preferred desk was available. I'd make sure the break room had his preferred snacks. He probably thought the hospital had just started stocking better supplies. He didn't realize it was me, buying things with my own money, bringing them in, creating an environment perfectly suited to his preferences. Other nurses started commenting, "You're acting weird around him. It's obvious you like him." I denied it, got defensive, started avoiding conversations about him, even though I thought about him constantly. My work started suffering. I'd be distracted during patient care thinking about him, wondering where he was, what he was doing, if he'd noticed my efforts. My husband asked if something was wrong, said I seemed distant, like my mind was always elsewhere. He was right. My mind was always elsewhere, in a fantasy where I wasn't married, he wasn't married, and that moment of synchronization during the code had been the beginning of something, instead of just a professional interaction. I started having intrusive thoughts, detailed fantasies about his marriage ending, about his wife leaving, about circumstances that would make him available. Then darker thoughts. What if his wife wasn't in the picture? What if something happened to remove that obstacle? I was horrified by these thoughts. I'm not a violent person. I'd never actually do anything, but I couldn't stop the thoughts from coming.
Year 12, I followed him to a conference. He was giving a presentation at a medical conference 2 states away. I found out through his social media. His wife had posted about being proud of him. I called in sick to work, told my husband I needed to visit my sister, drove 6 hours to this conference, registered as an attendee, sat in the back of his presentation. He didn't notice me. Why would he? He probably didn't even remember my name. But I was there, in the same room, listening to him speak. It felt intimate somehow. I followed him to dinner afterward, sat at a nearby table, watched him eat with colleagues, watched him laugh, watched him check his phone, probably texting his wife. I drove home that night feeling confused. Part of me was thrilled. I'd gotten to see him in a different context. Part of me felt desperate and pathetic. When I got home, my husband asked how my sister was. I'd forgotten I'd said I was visiting my sister, had to make up details about a visit that never happened. The lying was becoming easier. That should have scared me. Last year, my son had surgery. Minor procedure, nothing serious, but he needed me. My husband took time off work to help, expected I would too. The attending was running a family meeting that day for a complicated case. I knew because I'd checked the schedule obsessively. I told my husband I couldn't get the time off, that they were too short-staffed. Went to work instead of staying with my recovering son. Positioned myself to be involved in that family meeting. Got to stand next to him for 45 minutes while he talked to a patient's family. My son was fine. My husband was furious. Said I was choosing work over family. He was wrong. I wasn't choosing work. I was choosing proximity to someone who didn't even know I was obsessed with him. 6 months ago, I started parking near his car in the hospital lot. Not in the adjacent spot, that would be obvious, but nearby, where I could see when he arrived and left. I started timing my arrivals and departures to match his, creating coincidental encounters in the parking lot. "Oh, hey, heading out too?" He'd smile politely, make small talk for 30 seconds, walk to his car. I'd save those 30 seconds, replay them constantly. 3 months ago, I started following him on his drive home. Not every day, just occasionally, just to see his route, to understand his life better. I told myself I'd never approach him outside work, never cross that line. Just following wasn't harmful. But I knew it was wrong, knew it was stalking, couldn't stop myself. Last month, I saw his wife at the grocery store. I'd been driving past their house, had started doing it almost daily, and saw her car at the store. Followed her inside, watched her shop, noticed what she bought, what she looked like up close. She seemed ordinary. Nice enough, but ordinary. I couldn't understand what he saw in her, why he'd choose her over someone who understood him better, who worked in his world, who could synchronize with him during a code. I almost approached her, almost introduced myself, almost said, "What? I don't even know." I left the store before she saw me, sat in my car shaking, recognizing that I've crossed another line, that I was spiraling. 2 weeks ago, I started having more intrusive thoughts, detailed scenarios about how his marriage could end, about accidents, about circumstances that would make him free. I don't want to hurt anyone. I would never hurt anyone. But the thoughts keep coming, and they're getting more specific, more frequent, more disturbing. I made an appointment with a therapist, canceled it, made another one, canceled it again. Because if I tell a therapist the truth about the following, the stalking, the intrusive thoughts about his wife, they might have to report me, might see me as a danger. And if he found out, if anyone found out, I'd lose everything. My job, my license, possibly face criminal charges. But I'm losing everything anyway. My marriage is failing. My husband says I'm never present, never engaged. My kids barely talk to me. They've learned I'm not reliable. My work is suffering. I make errors because I'm distracted. And the worst part, he doesn't even know. This man I've built my entire life around for 5 years doesn't even know I exist beyond being that nurse on the unit. There's no connection. There never was. That moment during the code was just good teamwork. The coffee I bring him, he probably thinks the break room just started providing it. My perfectly timed encounters, complete coincidence to him. I've created an entire fantasy relationship in my head with someone who would be horrified if he knew what I was doing. I'm sitting in my car right now, parked down the street from his house. It's 10 p.m. His house is dark except for one upstairs light, probably his bedroom. His wife's car is in the driveway. His kids' bikes are in the yard. His life is in that house, complete without me, unaware of me. And I'm out here in the dark, watching, unable to stop myself. My phone is ringing. It's my husband, probably wondering where I am. I told him I was working late. I'm not answering because I'm not ready to go home. I'm not ready to face the reality that I've destroyed my life for a fantasy, that I've become someone who stalks and obsesses and has violent, intrusive thoughts about a stranger's wife. I need help, professional help. I know that. But seeking help means admitting what I've done, means consequences, means potentially losing my job, even if I stop now. And it means letting go of the fantasy, accepting that there's nothing between us, that there never was, that I've wasted 5 years building a delusion. The light in his house just went out. He's going to sleep next to his wife, in his life that I'm not part of and never will be. And I'm out here in the dark, watching, unable to stop myself. I should start the car, drive home, commit to getting help tomorrow. But I'm still sitting here, still watching his dark house, still believing, despite everything, that somehow he'll see me, that somehow this will turn into something real. even though I know it won't. Even though I know I'm sick. Even though I know I'm losing myself to this obsession. I can't let go.